Welcome to Well. I'm your host, Tracy Fredkin, founder of SoCal Moms and the SoCal Wellness Retreat. Join me as I chat with Southern California's leading experts in women's health, family health, nutrition, modern medicine, and the mind-body connection. We'll be vetting new trends, curating practical alternatives for today's busy modern woman to keep herself and her family healthy. This Mother's Day, we want to welcome and celebrate all the soon-to-be new moms to motherhood. It's a challenging time to be pregnant. I can definitely relate at 32 weeks. We're anxiously awaiting our own baby this June. In today's episode, we're talking to 3 experts about prenatal care, labor support, and postpartum in the age of COVID-19. ALTO Pharmacy is presenting this episode and provides a key service to families during the pandemic. Don't make another trip to the pharmacy. ALTO brings medication delivery straight to your door with expert advice from their pharmacists. Visit alto.com to schedule your free same-day delivery. That's ALTO.com. As we continue our birth stories for Mother's Day, I want to welcome our next guest, Dr. Shamsah Amersi, obstetrician and gynecologist. We've been following you on Instagram and especially your posts during COVID-19 around the incredible stories of birth. And we're super excited to talk to you and hear more about your practice and the different things you're experiencing in pre and postnatal care during this time. So welcome. Thank you for joining us.
Thank you for having me.
Do you want to start just by telling us a little bit about your practice and how things are evolving in healthcare right now as you see it?
So I've been in private practice for almost 20 years now, and I started my own obstetrics practice in 2013. So I have a very private, intimate setting where patients who are pregnant see me for every visit. They're not rotating through different doctors. I'm there for all of my deliveries. And so I feel like I have a really special relationship with my patients because I get to know them in such a unique manner. I get to spend time with them, and it's a lovely feeling where we have a connection, and it develops trust between a physician and a patient where they feel like they have a partner in their experience, especially during childbirth, which is one of the most important milestones that a woman experiences.
Interesting you talk about that, because I think one of the challenges for women right now with their prenatal care is this tension between wanting to go see their doctor on a regular basis and wanting to be reassured, and then being afraid to go to the doctor's office and maybe leave the house. And how are you balancing those health concerns? Are you seeing people as frequently as you otherwise would have? Are you doing more telehealth? I mean, how do you look at that?
I'm doing telemedicine for the non-essential appointments, but when it comes to pregnancy, I really feel that an in-person appointment is the most reassuring and important and validating for our patients. They do appreciate the fact that I'm open, that I'm seeing them, that I haven't closed my office like a lot of their physicians might have. I'm seeing other patients that are transferring to me because they like the fact that I'm able to show them on an ultrasound that their baby's healthy and thriving. They're able to get personalized COVID information and reassurance. Our goal is to use this time that's so uncertain and fearful and transform it into empowering our patients. So they enter their birth journey and even their births feeling that they have all the information and tools to be as protected and safe as possible. And they have a team that's doing their absolute most to keep them safe and keep their journey joyful, and not and also to mitigate any of their fears and concerns that they have, especially because there's so much unknown and there's so much conflicting information. Then the rules of the hospitals are changing rapidly. The information is changing rapidly. So as a physician, gather new data, I share that with my patients, and that it gives them direct access. And I think that's essential to have that instead of having to rely on the internet or so many different sources that can be very conflicting and scary during a time like this.
Yeah, you sort of brought up how things are continually changing at the hospitals and with delivery. Do you feel like you need to give different advice or have people make different choices about their labor and delivery? And what do people need to think about that's different with the hospitals? Or do you think that regardless of what the policy is, that, the care is the same and their considerations are just going and having the healthiest possible birth for them.
When the pandemic first started and the shelter in place started taking effect in Los Angeles specifically, I received a plethora of requests from patients and concerns about delivering at a hospital. They were worried that they would be inadvertently exposed to a virus, especially COVID, and that it was safer for them to maybe opt to deliver at home. But after spending time with me and after hearing my views on home birth compared to delivering in the hospital, all of my patients have stayed with me and have understood the importance of delivering in a hospital, because it's a safe way and a safe place to deliver your baby. In terms of the policies that are changing in the hospital is the most safest place to deliver during a pandemic like this. All the patients are tested when they go into labor, so they're given a rapid test on arrival to know if they've been exposed to the virus. We have extensive screening measures for their birth partners, for all the physicians and nurses who are present at the hospital. We don't have any ancillary staff that are joining the hospital, so we don't have doulas right now or students or anyone that isn't an essential part of the birth journey to be present. And so we really are mitigating the exposure to anything that would be concerning for our patients. In addition, the sanitation processes that are at the hospital are extensive, especially on labor and delivery where I work. All the nurses and physicians are provided with N95 masks. The patients are given the same thing, and they feel safe and very reassured. And when I first did my deliveries right after the pandemic started, even me as a physician, when I was entering the hospital, I was very apprehensive. Like, what was it going to be like? And would I be nervous being in the setting myself as a physician? Because I have a child at home and I have older parents. But I go to the hospital sometimes 5 to 7 times a day, going back and forth. And when I've seen what St. John specifically has done at the hospital for measures for patients who are delivering, I feel so reassured, and there's zero concern on my end about the safety for myself, my own family, and especially for my patients foremost. And I feel like the patients who've taken the time to understand what it's like to be at a hospital, they feel really reassured and they feel that they have a partner in this journey and they don't feel scared. If you deliver at home, which some people do opt to still do for various reasons, the concern is there's no proper sanitation. If there's a problem that happens, negative outcomes can happen by the time you're being transported to the hospital. And if you're working with a doula or a midwife, which I love, I think doulas are very essential as part of the birth journey for our patients, you still aren't getting the testing that's done on the people who are taking care of you. So you don't know if they've been tested and what their screening tests are like. And I just feel like the hospital is really the safest place to deliver.
No, that makes a lot of sense. I think, one of the things that's going on is there's just so much fear.
Mhm.
And so it makes people want to immediately change their plans or
Yeah.
make a quick decision, or, like I'm deciding in my pregnancy between a VBAC or a repeat C-section. And so there's just so much coming at you all at the same time. And then you're like, well, what if I can't have my partner? And then I'm alone in the hospital. And, I think there's a lot of just fear that goes on. And because it's changing, you're also trying to plan for something that's feels unknown, right? A week from now, maybe it's different than what's happening right now. But I think for women to make a snap decision to then change what they were always planning to do as a hospital birth, right? That has its own scary and totally unpredictable elements to it.
Well, the most important takeaway point for patients should be this: whether we're in a pandemic or we're not in a pandemic, patients are always coming to me with extensive birth plans. And I always tell them, let's rephrase it. Let's do it as a birth wish list. So, if all things are equal, if you're healthy and your baby's healthy, what are the things you hope I will honor during your delivery that are really important and personal to you and your partner? And we'll focus on that. But my plan is always one thing for my patients. And I tell them, healthy mom and healthy baby. And that's the plan. And sometimes if we're so dogmatic about a plan of how it's supposed to look, you end up getting disappointed because every delivery is different. If I deliver, say, 15 patients a month, Every delivery and every birth experience of those 15 patients is different and unique and special in their own way, but definitely different. So imagine if I had 15 patients and in a month that were delivering in April or May of this year, and I gave them all a birth plan that I execute, and they all were given the same plan by me. That's me treating them like they're a generic number in my practice instead of looking at them individually and looking at their medical history and the specifics of their pregnancy and their size of the baby and what's been going on during their pregnancy. And so I think making a decision about a plan can invoke a lot of fear in patients if they're so concerned about every detail. Instead, it's more important to focus on trusting your birth partner with being a present part of the journey. And then most importantly, your physician, who's the main person who's going to be taking care of you. And my job and my number one priority is to keep our patients safe. And then not feeling like your voice isn't being heard. So as a patient, if you feel concerned, which everyone is now, then the anxiety is sky high for everyone involved in this pandemic, and especially women who are going through pregnancy. The most important thing is to make decisions not based out of fear, but out of information. So listening to the concerns you have, and then making sure your concerns are being heard by your obstetrician. So for example, if you're choosing between a VBAC and a cesarean section, sitting down with your physician and discussing the risks and the benefits with each of those decisions, and then ultimately making a choice that you feel is right for you. And that's the best way I would recommend for any of my patients, to never make a decision out of fear, but out of empowerment, which comes from valid, honest information that's up to date.
I know a lot of women are also just thinking about how to stay healthy in their pregnancy and obviously trying to avoid getting things like the virus, but what's most important for keeping your immune system healthy and at sort of your optimum health level while you're pregnant, which is in itself just a challenging physical condition.
The newest focus on our patients during their prenatal care now is on immunity, because we recognize that every single person is responding to exposure to this virus differently. Some people have an absolutely catastrophic outcome from being exposed to COVID-19, and others are exposed and don't even know they have it. They're asymptomatic. And the response rate is based primarily on immunity. So we encourage our patients to optimize their immune system, and that comes from so many different factors. The first one would be diet, so making sure they're having a clean, healthy diet, minimizing refined sugars and processed food, having food that's high in antioxidants. Sleep is really important. So encouraging our patients to sleep 7 to 9 hours every night is really an important part of your pregnancy health right now. Stress levels cross over to the placenta. So for example, starting at 32 weeks, if a woman has high stress levels, you can actually measure the cortisol levels in their blood. And we also recognize that cortisol crosses over through the umbilical cord starting at 32 weeks. So the more stressed a woman is and the higher the cortisol is, the more cortisol is exposed to her fetus. And this is at all during all parts of a pregnancy, including when there's no pandemic. So mental health is essential, and that's why we encourage our patients to practice meditation. So spending 10 minutes a day just quieting their mind and focusing on their breaths. I encourage my patients to do that every single day, first thing in the morning. And then as part of maintaining a health during a pregnancy, exercise is really important. So especially for women who are isolated at home and are not going outside, which they shouldn't be going outside unless it's for something essential, like if they have to work and if they're an essential worker. But aside from that, I encourage my patients to exercise every day. So going for a walk outside and getting some fresh air and breathing in the sunshine for 45 minutes a day, just to get a break even from their partners at home. Sometimes it gets suffocating being at home with one person all the time. And then for the immune system component of it, the things that patients should add to their prenatal regimen are vitamin C and zinc. High dose vitamin C, at least a minimum of 5,000 milligrams a day is recommended. And then also zinc. And you can buy those easily on Amazon. There are lots of places you can get them. But that's what I would recommend, vitamin C and zinc. And then lastly, encouraging our patients to minimize exposure. Over the next few weeks, we'll see a laxity in the lockdown and the shelter in place restrictions. Businesses and life will slowly start to reopen again. And people are getting restless now and becoming a little bit more careless and more excited to leave their house than to stay indoors. And people are being careless about wearing masks and taking the measures that we were a month and a half ago, where we were really scared. And so it's important for patients to recognize that even if the shelter in place gets relaxed, that they have to continue taking measures, especially when you're pregnant, because we know from the physiological changes of being pregnant that if you are exposed to a virus like COVID, your body's response is much more heightened compared to somebody who's not pregnant. Because being pregnant is, in many aspects, like being in a state of being immunocompromised. And we know this from other viruses, like influenza. When patients get influenza and they're pregnant, their reaction to influenza is far more severe than their partner who doesn't have a pregnancy.
I know that makes a lot of sense. I think going into this sort of just maintenance phase of the virus, right? Where we're all trying to figure out how do we go back to some semblance of normalcy. And I think there is a fatigue.
Pregnancy is such a joyful time in our lives, and having a birth happen during a crisis like this is actually a miracle. It's a joyful experience. It's a welcome, positive addition to a family and to the extended family. And I encourage my patients and anyone who's pregnant to not let this experience of the COVID virus and being pregnant during a pandemic take away from that joy. In fact, now more than ever, it's such a special time. Like, you get this amazing, unique opportunity to spend time with your birth partner and actually have this emotional bonding that you might normally not have. You have time that you get to spend at home, where instead of having to work and go, which is what all of us were doing pre-COVID, we get time now to pause, to take care of our health, our physical health, our mental health, to eat well, to meditate, to exercise, to get a good night's sleep, to focus on our immunity, to focus on things that are really important to us, and to use this time to prepare for what the family is going to look like in a few months when you deliver your child. How that's going to look like in terms of creating a space that feels safe, getting information that makes you feel empowered, and most importantly, using this pregnancy to really remember that you have something really special happening and enjoy that, and don't let this take away from it. On the contrary, I think you should be very lucky that you get to experience such a beautiful, you know, a milestone in your life, and you're the one person that's going to the hospital that's going there for something happy. Most people that are going to the hospital are not going there because they're healthy and adding a miracle to their family, but they're going there because they really are sick. So you get to be that special patient that goes into the hospital healthy and gets to experience this joyous moment in your life. And all of us on labor and delivery, your nurses, your doctors, your midwives, your doulas, our whole goal is to support you through this joyous journey and to make sure that you feel safe and that nothing is taken away from you during this time.
I think that's a great point. A very good point for us to close on is, figuring out the joy in this situation and taking a breath during this time. I know for me, I would have been working nonstop, I'm sure, up until the day I had the baby. And so I think a forced pause is sometimes what we all need. And certainly something to look forward to at this time.
And so there are blessings in this that you have to almost like look for the silver linings, and it's just your perspective on all of this and trying to remain positive and optimistic and feeling safe and, really feeling like you're not alone in this is very important.
Thank you so much for taking the time today to chat with us. And this has been really insightful and very helpful, both practically, and then I think so many really good points about, what we can do just in terms of what we think about on a daily basis and appreciate. So we really appreciate it. We're excited to share it with our community, and hopefully we'll talk with you again more soon.
Perfect. Thank you again. Have a wonderful afternoon.
Thank
And
you.
happy
You too.
early Mother's Day.
Thank you. You too. Happy Mother's Day. As we continue with our birth stories in the age of COVID-19, our next guest is Lori Bregman. She's a doula, author, wellness, and women's empowerment coach, as well as the founder of Seedlyfe. Lori has helped bring dozens of babies into the world and put countless moms at ease through the birth process. And we're excited to get to talk to you today. So welcome, Lori.
Thanks for having me. I'm so happy to be here.
We're very excited to get your perspective on what's going on in the world of birth. I think maybe the best place to start is, how did you become a doula? Sort of what's been your path, and how do you work with clients in that capacity around their births?
So I've been a doula for around 19 years now. And I started, I used to do prenatal massage. And I would listen to what these women, what all pregnant women would be going through. And there would be like, their bodies would hurt. They were going through all this emotional stuff. They were, having terrible heartburn and nausea and all these things. And then just a lot of emotional changes as they were transforming, right?
Mm-hmm.
So when I was doing the prenatal massage on them, I was also, in nutrition school, and I was also, just looking up all these holistic remedies, and I was studying with these healers and taking prenatal yoga class, training class courses and spiritual life coaching courses, and doing like all these things. And so I was gearing it all towards pregnancy. And every time I learned something, I kept thinking, how can I gear this towards my pregnant people? And so I started giving them remedies and nutrition and helping them through the navigating the process with coaching. And then I heard about being a doula, and I was like, oh, that sounds cool. So I took the training for that. And it was just this weird, everything I wanted just kept going. How can I gear this towards pregnancy? How can I gear this towards children? How can I gear this towards moms? And I thought it was my own longing to be a mother. But at the same time, I was doing all this deep work on myself, and I got hypnotized, and I found that there was something that was running my life. I was a burden, didn't deserve to exist, and I was unlovable. And I was like, where is this coming from? And it turns out we went back in, and it all started in the womb. So I had no idea what my mom's pregnancy or birth was like me, but I started having a panic attack, and they took me out of the session. And I talked to my mom, and I found out there was just all this stuff going on. And she was really stressed that I was not planned. She was 17. There was just a lot of stuff. I was supposed to be put up for adoption. She went into a depression. There was all these things that I felt in the womb. So I realized that the way I came into the world set me up to do my life calling, which was to support women through pregnancy. And I just feel the more supported that they feel, the happier they'll be, the better that child within will be, and more prepared they'll be to be a mother. So I don't just do the birth. I support, usually my clients, I just had 4 people this week sign up with me that are due in December and January, because I support them through the whole pregnancy and prepare them for the birth and do coaching with them and give them holistic remedies and jump on the phone with them if they need to talk. And it's never been about the birth for me. It's always been about the journey. And then having that child, supporting that woman and the family, and having this baby come in gently, because it's the first imprint they have of the world.
We literally were just talking earlier about how stress and cortisol and all of those elements can cross over, right, and affect the baby. And we were talking a little bit about how the sort of panic and the fear around what's going on with COVID and different emotions that you have affect your pregnancy. And a lot of what we're talking about in general is wellness, which it sounds like is something that you sort of incorporate into everything you do with women, because it's so important for their health and that of their babies. I know you've written 2 books, right?
I have.
Can you tell us a little bit about that and sort of incorporating these wellness and mindfulness pieces into the process of becoming a mom?
Yeah. First of all, I'm big on supporting, I think, wellness, since this is a wellness platform. I think so many women focus on the foods they eat when they're pregnant, but really it is like my big thing is supporting you for the mind, body, and spirit, right? Because when one of them's out of balance, everything is out of balance. So my book, The Mindful Mom to Be, came out, I think it was like 7 years ago. And it's a holistic approach to pregnancy. Every month's a different theme, which helps you birth yourself as a mother. So maybe it's like tuning into your intuition, your motherly instincts. I give you natural holistic remedies for all your ailments, such as like heartburn and indigestion. There's a birth prep, all that kind of stuff. My other book is Mama Stay. And it's basically, it's a lot of shadow work, because I feel like in the mom world, there's so much judgment and projection on other moms. And really, usually what we don't like in somebody else is something we're uncomfortable in ourselves, or a fear of being something, or, it's triggering something that we don't like. And so when you can hold that mirror up and maybe like look at something that this person's doing as something you don't, and once you can accept it in yourself, then you can accept others. And then I have a new book, and that's a card deck coming out, I think over the summer. It's called the Doula deck, and it's broken up into 3 different segments. So there's pregnancy, birth, and new motherhood, and you just pick a card, and it's like gives you a mindful exercise to do during each stage.
I want to talk a little bit about right now how you feel about bringing babies into the world, and sort of what's changed when you're coaching women as they do go into labor with the hospital policies and supporting them. And I know a lot of people are now looking more at birth centers and home births and different options and trying to figure out what's right for them. How are you talking to women that you're working with about the challenges right now and about getting proper support?
The big thing I'm trying to do is keep everybody really present in the moment, because things are changing every day, right? Yeah. And I was updating everybody, and I'm like, this is happening. And then I realized that I was like basically updating everybody every day, and everything was changing. And so it was creating more stress than anything. So a lot of my people that are due in September, October, November, some of them are looking into home births as a backup plan. Mm-hmm. But midwives won't take you, because they vet you pretty hard if you're really not a candidate. And the reason there's so much success with home births is because you have to be a candidate, and you have to be that kind of person that really wants to do one. There's no epidural at a home birth. So I just try to keep them present, and just, kind of just take it day by day and not get too far ahead, but maybe have a backup plan if they feel they need. And let's just see where the world is in that place. Right now, I just did 4 births in the last 2 weeks. And one was an induction, and she went in at midnight, and I sat up on Zoom literally the whole night with her and her husband. And she had her baby, I think at like about 1 p.m. And, I breathed with her. We got her to like 5 centimeters, and she got her epidural, and I was like, get the attending only. And then I called all the nurses, and I was like, are you on? Can you be with my people today? And then I helped her push. I sat there and coached her pushing. And then afterwards, I sat there for, they did the bonding, and then got off, and then we talked after and processed. And she was just like, it's so weird. And I did all the birth prep in person, because I had done it. But I have been doing all the birth preparation and childbirth education with everybody via Zoom. But the other girls, I went to in early labor, like I always do. I go usually pretty early to people in labor if they need me. Okay. Because I like to work with people when their contractions, when they're like, the waves are a little smaller, so I can get them into a good groove. And then by the time they just start getting bigger, we're like in it. So I go to them early. I went to a birth when I was talking to you the other day. And we walked all day. And then at around 4:00, she went to the hospital, and I got on FaceTime, and I FaceTimed with her. And then we were talking, and I said, I have a feeling you're complete, And so I said, why don't you have the nurse check you? And she got checked, and she was complete. And then the doctor wasn't there, so we had to breathe. I was breathing with her to keep the baby in, and she was just like staring at me, and we were blowing. And then the doctor walked in, she pushed, and I was coaching her, and, you know, and so she had the baby 3 hours after she got to the hospital. So it's weird because it's weird doing it this way. It kills me not to be there because I love my people so much. But they're still getting the support.
Yeah. So the adaptability of it, I think what you were talking about too, is having that longer time with them gives you an opportunity, I assume, to develop trust with them and a relationship. So it's easier for them to feel comfortable relying on you in this format and whatever format is available to them, which is important. I think that the big piece of what you're talking about is building that relationship with them over time.
Yeah, I spend so much time with my clients and I give so much support, and they have access to me, and they can text me and they can call me, and I check in with everybody. So it's been, it hasn't been just the birth. It's been these 9 months. And some of these girls, like the ones that I've worked with, one was a new first-time mom that I never worked with, but the other ones have been second and third-time moms that I've worked with, that we're so connected and so close. And, I've done, the partners know what to do. I'm also telling them what to do. I'm always squeeze her hips, fan her off, right now, because they have to wear it. Cedars, I know if nurses are in the room, you have to wear a mask.
Is that right? I was going to ask you about that because I know it's a lot of people's fear. The mask just kind of get it going a little bit sometimes in terms of making things feel more serious and a little scary. Are they having them wear masks at the births at the hospitals right now?
So I'm at one of the hospitals, I know that they're doing COVID testing. So if you test negative, you don't have to wear the mask.
Okay.
But all the nurses and doctors are wearing masks. So, and then at the other hospital that I work with, the other one, at least this is what I've seen lately. Everybody has to wear a mask, but when the nurses or doctors are not in the room, you can take it off.
It's interesting how quickly people are adapting. I mean, that's why I think like being able to do what you do in this format, like in Zoom or FaceTime we've all had 6 weeks, which seems like a long time and a short time all at once, right? But there's all these new norms that we're just trying to accept. And I think you have to find the bright side of those situations, or sometimes maybe bigger moments like having your baby eclipse worrying about wearing a mask, right? In that situation. Yeah. Right.
And when I go to people in early labor and we're walking all over, I'll be in a mask. They'll be in, they don't have to wear one, but I'll be in one. And I just, I walked all night the other night, not the one that I did the other day, but we stayed up all night long and we walked the hills. And then, 5, 6 in the morning, I drove her and her partner to the hospital, and, she had her baby a couple hours later. So.
Do you find that's often better for people to stay home as long as they can before they go to the hospital? They'll feel more comfortable sort of in that environment? Or at what point do you decide it's time to go to the hospital?
Well, it depends. Like if somebody's wanting to or planning or intending to do an unmedicated birth, I think you stay home as long as you can. Yeah. So I can tell by the way. It's funny, the doctor the other day, I sent somebody to the hospital. I said, I think she's around, she said she's 4 centimeters. And I said, yeah, that's what I told her I thought she was. She said, did you check her? And I'm like, I don't check. I wouldn't even know what I'm looking for. It's like, I'm not a doctor. Like, I don't check. But I could tell by the way somebody's acting. I can tell by the contraction pattern. I can tell by like how they're responding and what their body's doing, how far along they are. But I always, if like this girl wanted an epidural. So I was like, she was kind of getting to the point. I was like, you get in there, get settled, go get one. But I've like other people that I'll keep home until they're like, I had a girl the other day, we were in Calabasas. We got to the hospital when she was 9 centimeters.
Oh my gosh.
We were like at her house and I was like, we should probably get to the hospital. So she walked in and like had her baby, 20 minutes later.
And it sounds like you have people that are across the spectrum in terms of, I want a completely natural birth. I definitely want an epidural. I want to see how it goes. Like, do you encourage people to know that ahead? How do you manage that process with them and figuring out what that's going to look like?
So I'm a big supporter in like, you do you. And I'm going to support you whether you get an epidural or you want to go unmedicated or you want to just kind of see how you go, see how it goes. You know, I don't really have a judgment or a preference. I mean, I like to try to get you as far as you can before any medical intervention, but the mom's really the one who's running the show. It's her body, it's her choices, and I'm there just completely to support her and educate her. And I don't project or there's no judgment. It's just that's my approach. If I judge someone for saying that an epidural is right for me, and I'm like, that's a terrible choice. How would they start? If I doubt their choices that they're making, how would they ever trust themselves as a mother to make the choices that feel right for them? Doulas and doctors and nurses and midwives, we all do completely different things, but we all work together in tandem as a team to support the mother and the birthing family.
What would you tell people as they're thinking about, when to get a doula, how to decide what doula is the right fit for them in terms of who they're going to feel comfortable with and be able to work with? I mean, it sounds like you start with your clients very early. How would you sort of tell people what to think about as they look at that process?
I think there's the doula for everyone, and there's every doula works differently. There's not like one doula fits all, right? So I just like for people that want a little bit more support and not just the birth, I do a lot of different things. I do meditation and breathing and all these different things. And, but there's find your person that you feel comfortable with. You have to feel comfortable. You know that feeling you get when you just vibe with somebody and you feel like relaxed around them and you feel like, oh, okay, I feel safe with this person. It's a feeling. I mean, it's like if you were going to hire a nanny or a baby nurse and you were just like, I don't like the vibe. I don't feel, I think that's a lot. I'd ask about I would ask about their, how long they've been doing it, how many births they take, what are their philosophies, what's included in their doula package. Is it just the birth? How much is it? Have you worked with my doctor? Have you worked in this hospital? Have you worked with my midwife? These are all questions to ask. You can start anytime. Like I said, I had 4 calls this week about December and January. But I like to get people early on because then I can really, really build that relationship.
Yeah, well, it sounds like that's an amazing benefit of working with you.
Mm-hmm.
Which is something in thinking about doulas, I don't know if I thought of before, but building that relationship over time. So come what be, by the time you're ready to give birth, you have that trust. And you've also been able to build in practices. I think for most people, they need time to adapt new practices to they're going through pregnancy. And it sounds like you're helping them along the way think about the different building blocks of having a healthy pregnancy and feeling strong when they get to the point of going into labor. You have a whole product line, right? Under Seedlyfe, is that correct?
Yeah.
Okay. Tell us a little bit about that and how that sort of goes into the mix of what you do.
I co-founded my Seedlyfe product line with my co-founder, Anna Rawson, who was a doula client of mine. I first came up with this fertility blend, this fertility smoothie idea that I was drinking to keep my hormones good. And then I gave it to one of my celebrity clients. I gave it to Molly Sims, who posted about it. And then her and I did a bunch of videos about it and it went viral. And people started drinking the smoothie and everybody was getting pregnant. Next thing I knew, we were like making our fertility blend. And then we did our pregnancy blend and a new mom which is basically a postpartum lactation blend, but it's like postpartum healing and lactation. And then we have a menopause and perimenopause blend, a PMS blend. We have a child's blend coming out, and then a male fertility vitality blend coming.
Well, I'm sure there's a lot of people that are going to be interested in the fertility smoothie. That sounds like a winner for people. I really appreciate your time today. This has been really helpful.
Oh, thanks for having me. It was great talking with you.
Today, I'm speaking with Dr. Jane Shomof, licensed marriage and family therapist, doctor of psychology, and founder of Bloome. She offers services for late stages of your pregnancy and postpartum, and she's going to tell us more today about how she supports women giving birth. So, Jane, Can you tell us a little bit about what inspired you to launch Bloome?
Yeah, totally. I'm happy to be here. I'm excited to be talking about this. And I know that so many women are, going through all this craziness during this COVID-19 situation. Um, so I initially started out my career working in addiction. That's actually my first specialty. And I did not expect to be in the peripartum maternal psychology realm that I'm now in. After I had my first kid, I had no clue like what I just got hit with. I had never changed a diaper before. I had never babysat. I'd never had experience with babies, but I figured, whatever. I'll figure it out. I'm a woman. I'm a strong woman. We're made for this. And then I had a kid, and it was everything was completely new, and I was not prepared. And I didn't understand what to do or how I was going to get through this. Fast forward to having my third kid, I realized that there still hasn't been that much shift in support for this really early time period. I mean, we wait till we have a 3-month-old and we can start the mommy and me classes, but I think all of the most difficult period is that 0 to 3 month time when you are spending the time at home and you don't really have or know what resources to turn to. So by the time you're coming into the mommy and me, you may already have a diagnosable postpartum mood disorder that you don't know, and you've been battling with all these months without any idea what to do. When I had my third child, I noticed they had given in the hospital like a mini depression inventory. So I'm like, okay, that's great. But I had a baby 24 hours ago. Like, I'm not depressed yet. I can push any button and have like 55 nurses come in and like pick up a leg and like take the baby to the nursery and, take care of whatever I need. It's when I come home and I am, by myself with my partner with very little support that I realize, whoa, what just happened to my life? What is this? So at that time, I realized that I needed to take that leap. I'd been thinking about it for a long time, that the need was there. And so I created Bloome. And what Bloome does is we plan for postpartum. We help women prepare for what it's going to be like after you have the baby. We spend so much time when we're pregnant preparing for the birth that, most of the planning that we do postpartum are, getting the clothes ready, the crib, the area or the room for the baby. We don't think about the emotional and physical toll it's going to have on our bodies and our minds. So we help moms plan for and walk through early postpartum so that they have their confidence and they feel like they can manage it all.
And in the past, did you usually start that? Like, do you want to start with women in the final trimester? How do you recommend sort of they come to you, how long they work with you, how they access that service from you? And has COVID-19 changed that, do you feel, in terms of both the way you deliver it and maybe the resources people need?
Yeah, so it's a great question. Initially I had in mind like a very small, target market of women that I was focused on, specifically in that 0 to 3 month time period, postpartum. What I found is that I had moms reaching out to me 6 months plus postpartum, 9 months plus postpartum in their pregnancy. And so as Bloome has evolved and grown, our target, moms are basically anybody who's pregnant, ideally in their third trimester, getting closer to giving birth. And then we have packages tailored for postpartum planning, which we meet you when you're in your third trimester and we have our postpartum planning session followed by several check-ins and then kind of a wrap-up session after a few weeks or months. It really depends on how much need there is. So the sessions are spread out depending on the client. Then we have a fourth trimester package, which is for the 0 to 3 month period. And then we have a postpartum package, which is anything 3 months plus. So that package looks a little bit more kind of traditional, where it's like 50-minute weekly sessions with check-ins sprinkled in throughout. That's kind of a deeper, you have to kind of come out of a deeper hole when you're 3 months plus, versus if we can catch it early and there's early intervention and education early on, you maybe don't have to go into that, deeper, darker place. In terms of COVID-19, the way that it's really impacted Bloome is we've just had an influx of clients, which has been, good and bad, right? We don't want to have these moms struggling, but we are happy that we're able to help support, everybody who is able to get in touch with us. Another thing that we've been doing is we've been basically doing 15-minute free check-ins for whatever questions anybody has that's going through a pregnancy or recently had a baby or is concerned about what it's going to be like to give birth at this time. It's very different. And so that's something we've been kind of giving back to the community that's been nice. But all of our sessions are virtual anyway, because the last thing you want to do right when you have a baby is leave your house. You'd rather waste $200 and just lose it than put pants on and actually leave your house. So that has been fine. We were already equipped for the virtual aspect of this. But it really just the need and the influx has gone up a lot.
Do you feel like, is this something you encourage women to share with their partners, and that you involve them or help them find additional support systems if they need them? Like maybe there are specific issues going on where they could get additional support, and how do you look at some of those questions?
So in our postpartum planning guide and resource that, like I said, is going to be available, hopefully very, very soon, we definitely involve the partners. We involve friends if they're available, any support system that they feel that they can really trust and connect with, is really important. And so you don't want anybody to do this alone if possible.
Yeah.
We also have a lot of moms who it's just them and their partner by themselves wherever they're living. They live really far away from family and friends. And so having a Bloome support specialist, like we have on our staff, is crucial. They're that person. They become that person to ask those questions, to feel like they're not going to be judged no matter what they say. And they can really be honest about how they're feeling, because so much of it, and so much of what I hear from moms, and I'm sure you can relate, I know I can, is when you have a baby, you expect to just be in bliss. And so when you feel feelings other than that, you automatically start to judge yourself. And you feel that you can't say it out loud, and you can't share that information with somebody else because they're going to judge you. What you're not realizing is everybody feels that way. And it's just as normal as the happiness and joy and love that you may feel for your baby to also feel feelings of sadness, of despair, of hopelessness, of isolation, loneliness, mourning your past life. There's so many things that you feel after you have a baby that you just have no clue that they're normal. And so having somebody to be able to validate that is so key in not planting that seed to grow, a postpartum mood disorder.
Yeah. Do you feel that the current sort of fear and panic around the virus is, and maybe the isolation as part of that, is exacerbating people's problems because they're so isolated sort of going into having a baby, and then just sort of that mental toll that's already been taken, maybe having nothing to do with the baby, but just in general.
Yeah.
And then you have a baby and you have all the hormones and all the emotions.
Totally. The isolation and those feelings of loneliness are definitely exacerbated. And at the same time, we try to also give it a positive twist when we can, in that if there's any time to be isolated with your newborn baby, it's in the beginning, right? It's much harder to be isolated, I'm sure, as you know, Tracy, with older kids. I don't even know how old your kids are. How old are your kids?
My son's 8, but I'm having a baby. I'm 32 weeks pregnant. Yeah.
Congratulations.
So I've been on, I'm on all sides of it. So I'm spending, and I agree with you. It's been interesting to be quarantined and be pregnant, which is obviously there's so many things, but it has forced you to slow down at a time when slowing down is probably good, right?
Yeah.
It's not all bad. But you're worrying about all kinds of things in addition to having a baby that
Yeah.
you need to be worried about. Yeah.
I hear you. I have an 8-year-old son as well, and an almost 6-year-old and a 2.5-year-old. So, if I was just pregnant, knowing what I know now, I'd be like, this is great. I could just, relax. You're not there because you have an 8-year-old that's also, that you're tending to. But yeah, so we try to give it that positive spin that if you're going to be in isolation with just you and your partner, whoever lives in your home, it's when you have your newborn, right?
Yeah.
At the same time. So we encourage things like, what we're doing, Zoom calls, FaceTime, ways to still be able to connect with family and friends. We're reimagining what date night looks like, nights, out but in with friends. And so all of that, so we're kind of helping women shift the idea of what they expect of their postpartum to look like versus what it actually is like with COVID-19. So having these interactions with friends and setting up times, to have a call with a girlfriend on FaceTime with a glass of hot tea, that's me mixing a glass of wine and hot tea.
That sounds good. You can mix things with wine, right?
Probably wouldn't taste so bad. Maybe it would. I don't know about hot wine. So I was thinking the friend would have the glass of wine and the breastfeeding mom would have the cup of hot tea. That's what that was. But still being able to foster those connections so that those feelings of isolation are lessened. That's really been helping a lot, and just being able to communicate with people. Going on walks, thank goodness, that's still available in most parts of the country. And so trying to do what you can to just go outside a little bit, breathe some fresh air, and adjust. Humans are actually masters at adjusting and adapting. I'm sure everybody can agree that the way that we've adapted in this, historical time has been remarkable. In the beginning, it was incredibly scary, and it still is, and there's still a lot of fear around it. But as time has gone on, everybody has found different ways to adapt.
Yeah, well, and that's one of the things I was saying recently is it's crazy, but we've been able to come up with a schedule and sort of a new routine, which does take some time, but I think helps you settle in, right, to things like this. Like, even though it's a massive shift, when you start to be able to calm down a little bit, right, and then you have to find a new normal. And I know for us, finding some routine has helped make things feel less chaotic. But those all seem, as there's always a positive, right, to take away. I mean, one of the things I wanted to ask you about is I feel like this is a great moment for telehealth in general. And people thinking about how they access healthcare in a different way, and maybe being open to accessing it in a different way. Do you think there are positive changes sort of along those lines that are, good for new moms?
Definitely. The whole, initially when we started Bloome, we weren't expecting to be strictly virtual. We thought we would be able to, especially in parts of the country where we are, so right now we're in Los Angeles only, we'd be able to do home visits, and we thought that could be helpful. And we found that actually wasn't, that the virtual sessions were actually the most helpful, because if you imagine you just had a baby and you come into a mom's home and you're like, we're going to make it easy for you so you don't have to leave, but we're naturally, I'm sorry, pardon the mess. Can I get you something? You can sit right here. Sorry about, And so we found that the moms are actually taking care of us rather than being just, how they are, who they are, where they are, and just getting to it. So virtually has really been the best way to connect with new moms. And I think the moms in general are really responding well to that. They're really happy that this resource exists and that telehealth is becoming more popular. It used to be not just inaccessible, but just not done, kind of frowned upon actually in the past. And slowly, it's been increasing in popularity. And now it's becoming obviously really recognized as a good and important and vital form of having, mental health care.
Well, and I think as you mentioned, a lot of us that live in big cities have more access, right? But we all need access to these types of resources. And so you're able to reach so many more people this way.
Definitely.
And to bring resources that are important. I think also, affordability, right? So there's accessibility, obviously, and then there's affordability. And I think the more telehealth grows too, you see that it becomes easier to make things more affordable and accessible for people that wouldn't otherwise have access, and to cover more people with those resources. What's the best way if people have questions, if they want to sort of dig deeper to what you're doing? Where do you recommend people go and get more information?
I always recommend to check out our Instagram. We update that every day, several times a day. We have amazing tips and resources, and in our stories, on our posts, that really connect with new moms and pregnant moms. We get a lot of really good feedback that, wow, your Instagram is really helping me. You can go on at any time.
Yep.
And that's at Moms in Bloom with an E. And then there in our Instagram, in our bio, you can access our website, and we have everything in there. Also resources, our blog is there, and you can look at our different packages and everything that we offer, more about me and our staff and our specialists that we have as well. And for whoever's listening, I'll give you guys my direct email if anybody has any questions after listening to this podcast. It's drjane@letsbloom.com. And again, it's Let's Bloom with an E.
And so people can reach out, and obviously it's great to be able to follow you, access the information in a forum where they're at all the time anyway, start to understand what you guys are about and get more comfortable. And then if they want to contact you and talk more, they can do that.
Totally. And we have,
yeah,
sorry.
Go ahead. No, go ahead.
I was going to say we do a free initial consultation. So that often helps answer any questions. Can talk about, is this right for you? There's packages available, also a la carte options. So it's really tailored to whatever the client needs. My biggest thing is to help do my part and prevent the occurrence of postpartum mood disorders as much as possible, because I feel like there are way too many. And with early intervention and talking about this and planning and preparing for postpartum, we really can see the numbers hopefully start to drop and drop and drop.
Yeah, no, I think that's the early intervention piece, right? And getting people the information. And that was one of the reasons why I asked you about when moms should know about this, because you don't want it to get to be too late, right? And you don't want them to be sort of down the line having been able to maybe make changes earlier and enjoy their experience and be in a better place. So I do think that's really important. We're trying to get the information to expecting moms and brand new moms when they need it, so that in a way that they feel comfortable with it now, so that it doesn't end up right down the road.
Exactly. And I think the last point that I want to make in this is, sometimes moms listen to this and they're thinking, oh my gosh, so what am I in for? Is this going to be horrible? Am I expecting to be great and it's going to be horrible? And I just want everybody to know that it's not going to be horrible, but it's not going to always be great. And they're both fine and they're both normal, and it's going to be different waves, and you're going to feel all sorts of feelings, but to just kind of ride the waves as they come and not to judge yourself, and go through the transformation that you're going through. Talk to people. Don't be afraid of your feelings, and be really kind and gentle to yourself. You're going to be okay.
I think that's a great point, especially about for people understanding it's not always, there are highs and lows, right? And it goes up and down, and it doesn't always have to be severely negative or severely positive, right? And the idea is that you have support throughout all of those moments. And I think with your services as well, people don't have to have severe anxiety or severe. Sometimes it's literally just having the support and someone to talk to and someone who understands what you're feeling. And I think that's another piece of it too. You don't have to self-diagnose yourself, right, as having this or having that. It can just be, I need some extra support at this time, and I want someone to talk to who I feel like has an informed, understanding point of view.
Yeah, and it's often super short term. Oftentimes moms just need to know what to expect. And so when the feelings come, they know that they're normal and they don't dig themselves a deep hole about them. And you asked earlier, how long does somebody usually see you? If we start with them in late pregnancy or really early postpartum, it's honestly not more than 3 months usually, if even. It's just getting their footing, getting their foundation, and getting comfortable.
Yeah, that makes a lot of sense. We really appreciate your time. This is great information for all of our moms, and we're excited to share more and definitely get people involved and asking questions and talking about this topic as much as possible. And we're looking forward to talking with you more soon.
Thank you, Tracy. Congratulations again, and let me know if you need anything.
Yeah, I know. Now I have to call you. I'm in that. You're like giving me all the OGs. I am not I've done all the wrong things.
No, there are no wrong things. Listen, I do all the wrong things all the time. It's okay.
I know. I said things will be different with this baby, so we definitely have to plan ahead more than we did the first time going into it.
Yeah, well, let me know if you need anything, but you're going to be great.
We'll definitely be calling you. Thank you so much.
Okay. Thank you.
Have a great afternoon.
You too. Thank you. Bye.
Bye.
May is Maternal Health Awareness Month, and we've partnered with the Mom Genes Campaign, a research study using the DNA of moms who have suffered from postpartum depression to help find a cure. They need 100,000 moms to donate their DNA and join the fight so they can continue this critical research. Follow them to learn more at Mom Genes Fight PPD. Yesterday on our Instagram, we shared a COVID-19 pregnancy moment from Allie Levine, Stuart Brazel, and Janetta LaFond. Thank you, ladies, for your words of wisdom. As a pregnant mom myself, I can certainly identify. And thank you to our giveaway partner, 10 to 12 Baby Lounge, for celebrating these stories with us. This special extended edition of Birth Stories presented by ALTO Pharmacy encompassed so much about the miracle of birth and new motherhood, with a focus on keeping you well during these challenging times. We'll continue to talk about these important questions in future podcasts, and we hope you will join us. A special thank you to our guests today, Dr. Jane Shomof, Dr. Shamsah Amersi, and Doula to the Stars, Lori Bregman. If you love this episode as much as we did, please help us grow. Be sure to subscribe to our show on iTunes and other podcast streaming platforms. You can also watch the video from this podcast on SoCalMoms.com. Sign up for emails on our website and follow us at SoCal Moms on Facebook and Instagram. We welcome your comments and feedback. Until next week, I'm Tracy Fredkin, and I'm off to spend Mother's Day with my family.